Other headlines now. The UK is mulling removing France from the safe travel green list and adding it to the list of countries requiring quarantine. Cases are back on the rise in France and indeed across the whole of Europe. New cases are creeping up at a rate of 20,000 a day. That's a concerning uptick. You can see France in bright blue in the bottom right. Still no comparison, of course, to the problems of the United States and Brazil. Dr. Hans Kluge is the Europe Director for the WHO and joins me from the Dordogne in France. Doctor, this obsession that the European countries have on you've just gone above my per capita of 100,000, you've just gone below it, you can now come, you can't go, all these sort of things. Is it worthwhile doing it that way?
Good evening, Richard. Well, what we see is that the countries have specific country thresholds. So they look at the number of new cases per 100,000 population. And if you go above the threshold of another country, then certain measures are initiated. But you have a good point. I mean, what's important here are two things. One, we are not in the situation as in February, where we were targeting economy, targeting the people, the education. Now we have knowledge to target the virus. And number two, what we need is a regional policy, so not country by country, and to communicate it very clear to the public to instill public trust.
When you say a regional policy, I mean, isn't that what the European Commission and the EU is supposed to be doing?
Right. So my region, Richard, encompasses the 53 European member states, and that's very important because no country is safe until everyone is safe. You can't stop at the border of the EU, right? So WHO Europe is trying to harmonize across the larger European region. And that's why today I announced the Pan-European Commission on Health and Sustainable Development with Professor Mario Monti as its chair to look how to harmonize and learn lessons to make our society, health and social care systems much more resilient.
All right. All right, that's all very well to be looking to see how to make them better in the future. But at the moment, there is this confusion and patchwork of, let's just take the UK, for example. Well, Belgium's now on the list of quarantine. France might be on the list. Spain's on the list. Questions of whether to have mainland Spain or the Balearic Islands. You'll agree, Doctor, this is no way to get any form of clarity for people so they can go about their lives.
Well, Richard, we have to understand 31 out of 53 countries are seeing quite a significant increase in cases, which is anticipated once the lockdowns were lifted. So absolutely, to regionalize the solidarity looking across the borders is very, very important. We saw this in the beginning and also now. That you have a great point.
Is it inevitable that when we reopen, the number of cases goes up, and it is only the job really to mitigate so that that doesn't get too bad?
Right. So we are not in February where the default option was to shut down and reboot. Now we have a lot of knowledge, basically through community engagement. So it's our social responsibility. I believe it was you, Richard, who one time told we should not throw away any penny. It is by saving pennies you get incrementally rich. And that's what we have to do. We all have to save our penny, meaning behave individually, safe and responsible, engage the youth, and then we will yield global health security.
So I realise that, you know, we may both be saying the same point here, but I was in Prague last week where masks are nowhere to be seen and social distancing is in name only. I mean, it doesn't exist. The UK has masks in the street, in shops, but not on the streets. Here in New York, frankly, I'm relieved there are masks everywhere. Doctor, how do you get uniformity accepting the difference in conditions in individual countries?
Right. I mean, we also have to be realistic, right, Richard? There is the reality and then the ideal. I'm quite pragmatic. So my approach has been to work through what I call targeted health diplomacy. I have been speaking since day one with ministers, presidents, heads of state, individually and sub-regional. And if we go sub-regionally with targeted health diplomacy to unify, then the countries will feel that no anyone is left out when we have a policy decision. Our function, my function, is to help the countries to empower their leadership so that they make the right decision within a contextualized situation.
Hopefully you'll come back and talk more as the summer comes to an end, and we really do need to understand what happens in the autumn and the winter. Good to have you, Doctor. Much appreciated joining us tonight from France.
My pleasure.